Doctor, people have put their lives on hold, and with that, so many regular annual appointments, checkups, physicals, screenings, people have put aside and almost been afraid to go to the doctor. If you've got something going on and you are just really kind of scared, what advice would you have?
Well, the most important advice that I give to all people is that you need to have a good primary care doctor or a clinician that you trust. Someone that will be available to you, that you can pick up the phone and ask questions to, that you can go see, who has a schedule that is flexible enough that doesn't make you wait weeks to get in to see them. And during the pandemic, we added to that by allowing telemedicine visits to become a more frequent thing. And so not only could you go and make an appointment, you could actually get on the phone and speak to someone face-to-face via a telemedicine link. And in northern New Jersey, it's really at the point now where it's safe to go get routine care.
So for people who are saying, you know what, I think I'll just put it off until next year's annual. I'll just put it off. What would you say?
So I think that's a major mistake. The guidelines that are put out by the professional organizations and the experts in terms of how often you should have a colonoscopy and a mammogram and a pap smear, those guidelines are there for a reason.
There's so much information for people to take in and to try and understand and process and then figure out what is best for them. So if you were writing a prescription for people who are watching and listening to you, what would that prescription be?
It's a good question. I would say that they should try to resume their normal life knowing that things are not normal. So we need to start doing the things that we need to do to stay healthy. We need to go outside and exercise. We need to communicate and reconnect with our family and friends in a socially distanced, safe way. But getting back to going to visit your parents, if you haven't done that because you were concerned that you were putting them at risk, I think now is a safe time to do that. And so we need to resume some level of normalcy, but at the same time, keep wearing our masks, keep staying socially distant, keep staying 6 feet away from each other whenever possible, and also watching and listening to what's going on in the community.
Some people think that they're doing the right thing by staying home. I'm not sick, I'm healthy. I'll get my checkup in 6 months. What's the danger?
There's the person who was having some back pain or some belly pain or some chest pain, and they're like, well, it's not that severe, I'll just let it be. And if people are putting those things off because they're worried about COVID, I understand that, but I'm worried that we're going to delay making diagnoses that we really need to make as soon as possible so that we can get the patient the right treatment, because those screening appointments are incredibly important at keeping you healthy.
What about a regular traditional flu shot? Would you still recommend people get a regular traditional flu shot?
More important than ever. Literally getting a flu shot not only can save your life, but it can save the lives of the people around you. And in the midst of this pandemic, when the flu season comes upon us, we are going to have a really tough time if people don't get their flu shots. Tough because we're going to see a lot of sick people, and tough because we may have a difficult time differentiating flu from COVID-19. And so the more people who get flu shots, the better. They are very, very safe. There's no such thing in life as anything that's 1,000% safe, but people should take their flu shots. If you're willing to get in your car and drive down the road and take the risk of getting in your car, a flu shot is as safe, if not safer than that.